I'm Dr. David Hill, and today we're going to talk about how to treat bronchitis in babies. Now, this is tricky because there are a couple of very closely related words. They sound almost exactly the same, but one is a diagnosis that is common and potentially very dangerous in babies, and another is a euphemism for a cold. So, when we say bronchitis, that really just means a viral infection of the upper airway, and we think of that as a cold. A bronchitis, by definition, does not require antibiotics. If the symptoms are going on greater than 10 to 14 days for the runny nose or stuffy nose, or greater than 3 weeks for the cough, we may call that a sinus infection, sinusitis, get worried about pneumonia, asthma, some other problems. But initially, in babies and children, bronchitis is just another word for cold. We distinguish this from bronchiolitis. And what's the difference between bronchitis and bronchiolitis? It's the size of the pipes that are involved. If you imagine the lung as an upside-down piece of broccoli or tree, you can think of the trachea as the trunk, or the biggest part. That branches into two main stem bronchi. That's what's infected in bronchitis. But then the branches continue 9 to 11 times until you get to the smallest tubes. These are called the bronchioles. Those tubes can be very easily clogged if they get infected by certain viruses. The most common virus that infects the bronchioles is called respiratory syncytial virus, or RSV. Now, you and I can get RSV as adults. It's just another cough and cold, doesn't bother us at all. But in babies, the tubes are so tiny that those infections can be life-threatening. They get blocked up really easy. This is bronchiolitis. Bronchiolitis usually requires evaluation by a doctor. You may notice wheezing. You may notice the baby's having a difficult time breathing. Maybe grunting with every breath, going, You may see the nose flaring. You may see skin pulling over the chest or in between the ribs or under the rib cage. Those are all signs of respiratory distress. Certainly if you hear wheezing, that's concerning. Those babies, especially young infants, age 2, 3, 4 months of age, really need to be evaluated urgently to see if they need hospitalization, oxygen therapy, or sometimes albuterol or steroids, depending on how well they evolve. So, talking about bronchitis versus bronchiolitis in babies, I'm Dr. David Hill.